Right now, this very moment, while you are sitting in your chair or lying in bed watching this, something is happening inside your body that most people over 60 quietly dismiss, ignore, or chalk up to getting older. Those swollen legs you noticed this morning when you put on your shoes, that puffiness around your ankles that was not there 2 years ago, that heaviness you feel when you climb the stairs at the end of the day, that is not simply aging. That is your body sending you a signal, and it has been sending it for longer than you realize. The frightening part about this is not what you feel. It is everything happening underneath what you feel. The internal pressure quietly building, the systems quietly straining, the clock that has already started without your permission. Your veins, your heart, your kidneys, they are all connected to this one visible symptom. And if it is going untreated right now, every single day that passes is a day the picture gets more complicated. Here is the truth that most people in their 60s and 70s are never told in a clear enough way. Swollen legs are not a cosmetic problem. They are a warning. The good news, and there is real, meaningful good news, is that you are watching this now. And now is exactly when this information can still make the biggest possible difference. By the end of this video, you will know what is causing this, what your body is actually doing, and the specific steps that can begin turning this around, starting today. And the longer this continues without being properly understood, the more serious the picture quietly becomes. So, let us start with what is actually happening inside those legs, because this is where most people get it wrong. They look at the swelling from the outside and they assume it is just water, just fluid, nothing serious. But here is what the science actually tells us. The most common cause, accounting for roughly 70% of cases of leg swelling in older adults, is a condition called chronic venous insufficiency, or CVI. And the reason most people have never heard of it explained properly is because it develops slowly, silently, without dramatic warning signs. Picture your leg veins right now, not as simple tubes, but as a living, working system that has one essential job: to push blood back up toward your heart against the full force of gravity. Every single beat of your heart depends on those veins completing that return journey efficiently. Chronic venous insufficiency occurs when your leg veins cannot allow blood to flow back up to your heart the way they should. Normally, the valves inside your veins ensure that blood moves only in one direction, toward your heart. But when those valves begin to weaken and fail, blood can flow backward. And when that happens, blood begins to collect, to pool, right there in your legs. Think about what you did yesterday. Think about how many hours you spent sitting at a table, in a car, in front of a television. Because here is what that sedentary time does to your venous valves. It removes the natural muscular pumping action in your calves, the very mechanism your body depends on to push blood upward. Chronic venous insufficiency usually affects people over the age of 50, and the risk goes up the older you get. That means if you are watching this in your 60s or 70s, this is not a distant possibility. This is a present tense reality that deserves your full attention right now. CVI is often brushed off as a cosmetic issue or a natural part of aging. But that misconception can delay treatment and lead to serious complications. And those complications? They are worth understanding clearly, because what happens next, if nothing changes, goes much further than swollen ankles. This is not the most serious part yet. What comes next is, what happens next if this process continues unchecked is something most people are genuinely shocked to learn. Because this is where swollen legs stop being a discomfort and start becoming a genuine health threat. Let us stay inside the body for a moment. Picture those leg veins again, now with pressure building inside them. Day after day, pooling blood increases that pressure, and the walls of your tiniest blood vessels, your capillaries, begin to strain under the load. Chronic venous insufficiency slows down blood flow from your legs back up to your heart. Without treatment, CVI raises the pressure in your leg veins so much that your tiniest blood vessels, the capillaries, can actually burst. When that happens, the skin in that area takes on a reddish-brown color and can easily break open if bumped or scratched. And that is not where it ends. Venous stasis ulcers, open wounds on the legs, do not heal easily, and they can become infected. That infection could spread to nearby tissue. This condition is known as cellulitis, and it is dangerous if not treated right away. Think about what time you went to bed last night. Think about whether your legs were elevated or dangling. Think about whether you drank enough water or ate a salty meal for dinner. Because those choices, those quiet, ordinary, end-of-day choices, directly affect the pressure inside your veins while you sleep. But here's the part that makes swollen legs even more serious. It is not always just a vein problem. Other serious causes of leg edema include congestive heart failure, kidney disease, and liver disease. If you have heart failure, your heart is not able to pump enough blood out through the arteries and bring it back through the veins. Without proper treatment, this can cause blood to pool, especially in your legs and feet. And if the kidneys are involved, kidney failure means the kidneys are no longer able to filter fluid from the blood and turn it into urine. Kidney disease often starts with inflammation, and this type of fluid retention is usually visible as swollen legs and ankles. So, when you look down at those legs tomorrow morning, the question you need to be asking is not just why are they swollen? The question is, which system is sending me this signal, and how far along is the process? If the leg swelling is present in one leg only, or if there is a lot of pain, or if you notice shortness of breath, chest pain, or trouble breathing when lying flat, this could be a sign of an urgent problem that needs medical attention right away. But there is still one more layer to this. And it is the one that explains why the body allows it to progress as far as it does. What I am about to share next is where the real mechanism becomes clear, and it is the key to understanding why your body does not simply fix this on its own. Here is the hidden biology that most people are never shown. Your leg veins contain a series of one-way valves, tiny flap-like structures whose only job is to open as blood moves upward and snap shut to prevent it from falling back down. Chronic venous insufficiency happens when the valves in your leg veins stop working properly. Your leg veins contain valves that help your blood flow in the correct direction, toward your heart. If a valve becomes damaged, it cannot close properly. Gravity takes over, and blood struggles to flow upward. It instead flows backward, a situation known as venous reflux. Now picture this happening not in one valve, but across dozens of them simultaneously. Every time you stand up in the morning after sleeping all night, every time you sit through a long afternoon, every time your calf muscles fail to contract enough to push blood upward, that pooling becomes a little worse. And then the fluid equation begins. Venous obstruction increases hydrostatic pressure, which predisposes the body to edema. Since the body's plasma volume is only about 3 liters, large amounts of water and electrolytes begin to diffuse into the interstitial space, the tissue surrounding your veins. That is the swelling you can see and feel. But here is what you cannot feel. In venous insufficiency, venous stasis results in abnormally high venous pressure and greater permeability of the blood capillaries, which forces the lymphatic system to work overtime, trying to drain the excess fluid from the lower legs. But the lymphatic system is not as efficient as a healthy circulatory system, so the swelling becomes visible, particularly in the ankles and lower legs. Think about this morning. Think about the moment you stood up from bed and felt that familiar heaviness in your lower legs within the first few steps. That sensation is not random. That is the overnight pooling of fluid, making itself felt the moment gravity pulls it all downward again. The chronic increased fluid in the lymphatic system causes an inflammatory response which leads to tissue fibrosis, scarring, of both the veins and the lymphatic system, opening a vicious cycle that worsens the condition over time. This is the silent process your body is caught inside. Not dramatic, not painful enough to force you to a doctor immediately, but progressing, building, compounding. The window for the easiest intervention is still open, but only if you understand what the turning point actually looks like. Here is what changes when the trajectory shifts, and this is where the story moves from warning to possibility. Because everything I have described so far, the valve failure, the pooling, the pressure, the inflammation, all of it is responding to something. All of it is influenced by choices that happen at specific times of day, in specific patterns that you have more control over than you may realize. The turning point begins with a single honest question. Is your swelling new, or has it been building quietly for years? Because the answer changes everything about what is possible. In clinical experience, swelling in the feet and legs is rarely just one isolated issue. It is usually a sign that something in the body's blood circulation or fluid regulation is not working efficiently. When the heart cannot pump blood efficiently, as seen in congestive heart failure, or when the veins struggle to return blood upward due to venous insufficiency, fluid begins to pool in the lower body. That means the turning point is not one big dramatic moment. It is a series of small, consistent daily interventions that begin redirecting the biological momentum. Think about what you ate last night. Think about whether that meal was high in sodium, salty foods, processed foods, restaurant meals. It is important that anyone prone to edema, especially older adults, eat a healthy, low-sodium diet. Excess salt in the diet can lead to fluid retention and negatively affect cardiovascular health. Think about the last time you took a walk. Not a marathon, just a deliberate walk. Because here is what walking does that most people completely underestimate. It activates the calf muscle pump. Movements engage the muscles in the edematous area to pump excess fluid back toward the heart. This is the body's natural anti-swelling system, and it requires you to move to activate it. While CVI is chronic, consistent care can keep symptoms under control and improve quality of life. CVI may be common, but it is far from harmless. Left untreated, it can chip away at quality of life. However, with early recognition and expert care, patients can stay ahead of symptoms and avoid serious complications. The body is remarkably capable of meaningful response when given the right inputs. Not a cure, but real, measurable, daily improvement. What I'm about to share next is where the real window of opportunity opens. And it starts with what you do in the next 24 hours. So, the first move is getting evaluated, and I want to be very clear about this before we go any further. Swollen legs after 60 are never something to simply observe and wait on. Always be sure to get evaluated for new or worsened leg swelling to make sure a serious medical problem is not at hand. Your doctor needs to determine what system is driving this because the treatment is entirely different depending on the cause. Leg swelling can stem from different causes, so a doctor needs to rule out other potential causes. Older patients may have other medical issues, such as congestive heart failure, kidney disease, or liver disease, that can cause swelling. Medications can also cause leg swelling. Blood clots in the veins can lead to leg swelling as well. Do not assume. Do not wait for it to resolve on its own. Schedule the appointment. But while you are waiting for that appointment, or if you are already working with a doctor on this, here are the first moves that begin making a physical difference right now. Move 1, elevate your legs. Not just propped on a pillow. Properly elevated above the level of your heart for at least 30 minutes in the morning and 30 minutes in the evening. Dependent edema, the most common type, commonly improves with elevation and worsens with prolonged standing or sitting. Think about tonight. After dinner, instead of sitting in the same chair for 2 or 3 hours, lie back and elevate those legs. That single evening habit begins changing the fluid dynamics in your lower body within the first session. Move 2, start moving your calf muscles deliberately. Avoid long periods of standing or sitting. On long car or plane rides, flex and extend your legs, feet, and ankles about 10 times every 30 minutes. This is not exercise in the traditional sense. It is mechanical fluid pumping. Your calves are a second heart for your lower body. Every single contraction pushes venous blood upward. Move 3, reduce your sodium intake, starting at your very next meal. High intake of processed foods and certain medications, such as calcium channel blockers, can all lead to fluid retention and worsen swelling over time. Read labels. Avoid packaged soups, cured meats, and restaurant-prepared foods for the next 7 days and track whether the swelling changes. These are not small adjustments. These are the inputs your venous system has been waiting for. But there is one more level of intervention, and it is the one that creates the sustained, long-term protection your body needs going forward. This is the level of change that transforms a temporary improvement into lasting protection. And it is where the story of your legs changes permanently. If you are watching this and you recognize what has been described here, if this feels like it was written specifically for your situation, type the word "today" in the comments right now, because that word means something real. It means you are not waiting until next week, not after the holidays, not when things slow down. Today. And here is what today looks like in practice. Compression therapy. Using compression stockings as recommended is a proven way to reduce swelling. Medical-grade compression stockings, not the loose ones from the drugstore, apply graduated pressure from the ankle upward, physically assisting your failing valves and pushing blood toward the heart. They should be put on first thing in the morning, before you stand up, before gravity begins pulling fluid downward. This is a morning habit that costs almost nothing and delivers measurable results. Lifestyle changes play a critical role in long-term edema management. Increasing physical activity to stimulate the calf muscles and improve circulation, elevating the feet and legs to reduce pressure, limiting processed foods that contribute to fluid retention, and avoiding sitting or standing for long periods are all recommended. Daily walks, even 15 minutes after breakfast, 15 minutes after dinner, activate that calf pump consistently. The consistency matters more than the duration. Skincare is the overlooked intervention. Skincare is a critical step to prevent venous ulcers, which can occur as a serious complication of chronic venous insufficiency. Moisturize your lower legs every single evening. Inspect the skin. Watch for any redness, open areas, or changes in color. Caught early, skin changes are manageable. Allowed to progress, they become a serious wound care problem. Moisturize daily and watch for skin changes. Stay in touch with your healthcare provider for regular follow-up. And weight management, which may be the most uncomfortable thing to discuss, but the most important for long-term vascular health. Risk factors for CVI include obesity, sedentary lifestyle, and prolonged sitting or standing. Every excess pound adds pressure to the venous system. Every pound reduced takes pressure off it. This is not about appearance. This is about vascular load. Research shows that meaningful, sustained change in leg edema is absolutely possible with consistent daily commitment. The body responds. It is remarkably capable of recovery, even after years of developing this condition. The window is open, and the next step is simply beginning. You can stop the alarm now, because the most important thing has already happened. You showed up for this information, and that is not nothing. That is actually everything. You now know something that most people over 60 will spend years never learning in this kind of clear, connected detail. That swollen legs are a message from your circulatory system, a specific, biological, addressable message, not just a side effect of age that you have to accept and live with. Your body is not your enemy in this. It never was. Most older adults can treat their leg swelling with the right strategies and maintain their usual activities and quality of life. Your veins, your heart, your lymphatic system, they have been doing their best with what they have been given. And what they are asking for now is not dramatic. It is consistency. It is elevation. It is movement. It is lower sodium. It is a doctor's evaluation that finally puts a name and a plan to what has been happening. Though leg swelling is a common problem in older adults, it should be taken care of seriously. Once the first signs of swollen legs are detected, visit a doctor for evaluation and treatment. I want you to live fully. Not just survive your 60s and 70s, but actually feel well inside them. Feel capable inside them. Feel strong inside them. That is a real possibility. Not a guarantee, not a magic fix, but a real, earned, daily possibility that begins with the next decision you make. So here is your path forward. Make the appointment. Elevate your legs tonight. Put on proper compression stockings tomorrow morning. Reduce the sodium at your next meal. Walk after dinner and check your skin. That is your action list. It is not overwhelming. It is a beginning, and beginnings are everything. If this video helped you see your legs differently today, if it gave you something real to work with, pass it along to someone who might need to hear it. A spouse, a sibling, a friend who keeps saying it is probably nothing, because for them, this information might arrive at exactly the right moment. Stay close to this channel, because what we cover next is going to be just as important for your health, your energy, and your quality of life. I am Dr. Arthur Bennett.